My name is Dr. Arun Bhanot. Today I'm going to talk about the role of facet joint syndrome in the origin of back pain and what are the things we need to understand about facet joint pain and what are the corrective measures that we can undertake to get relief from such kind of a nagging back pain. Our spine is a combination of multiple bones stacked one over each other. These are the vertebrae, the bones in the spine. 1, 2, 3, 4, 5. These are the lumbar 5 vertebrae. The nature has given us these vertebrae stacked one over each other to allow an erect posture. But this spine is not a rigid or a stiff column. It is a flexible column. That is the reason we are able to bend, twist, run, and all these movements are permissible because of the flexibility given to us by nature in our spinal column. Flexibility is derived from two main sources. One is the intervertebral disc, the soft cartilage gel-like structure that lies here in between the two adjacent vertebrae and which is compressible, which can permit some kind of a shock absorption effect. And the second mobility comes from the back, which is the facet joint. This is the facet of one vertebra, this is the facet of the other vertebra. So these are the two bones that articulate each with each other, and you can see the movement is happening at the joint in the back and at the disc in the front. So this part of the vertebra is facing the front and this part of the vertebra is the back. When we touch our back, and the hard bony prominence that we feel is this process that we call as spinous process. So disc is also possible sources of back pain, but facet joint can also lead to back pain in significant number of cases. So facet joint, as I already told, these are the facet, these are the articulating processes. These bony prominences are covered with shiny layer of cartilage, that is the smooth shiny layer that permits smooth gliding of the two adjacent bones with each other. This shiny layer is also lubricated for a smoother function of the facet joint movement by a lubricant fluid that we call as synovial fluid. So we can see here again in the picture. So this is the vertebra on the top, this is the vertebra on below. In between the two vertebra we can see this blue colored thing. This is called as an intervertebral disc, and in the back we can see this bone is coming from this vertebra and going down, and this bone is coming from this vertebra and going up, and in between these two, this is the facet joint where the movements of the back happen. Here, this is another model of the spine, the lumbar spine. These are the bones, these are the discs in between the two bones, and this here, structure here where I am moving, showing this movement, is the facet joint. So one can see the spinal nerves, this yellow colored structure on the right and left. This is a pair of nerves arising at every lumbar level. These are the nerves that arise from the spinal cord, which is lying within the center of the bone, the bony canal, and through these openings, which are called as the foramens, the nerves are coming out, and we can see that these foramens are quite closely related to the facet joints. So if there is a problem of the facet joints, it can cause pain per se arising from the facet joint, and sometimes these facet problems can pinch the nerve that come out of the spine and cause radicular pain to the patient, that the pain that goes down the buttock, the thigh, the leg, or along with the pain there could be some tingling sensation, there could be some numbness, there could be some heaviness in the legs, sometimes walking disabilities. Actually one motion segment where there is one vertebra above, one vertebra below, there is an in-between disc, and then there is a facet joint. So this we call as motion segment. This motion segment is intricately linked to each other. The structures in the motion segment are intricately linked to each other's function. So if we see here, the disc is maintaining its height, normal height between this vertebra. The facet joint is also maintaining a normal alignment and structure. But if by wear and tear of the life that happens with each passing day and year, the disc tends to shrink, this tends to shrivel. So if this disc goes down, it will put abnormal stresses on the back, the facet joint. So what it will lead to There is initial damage in the disc leading to abnormal pressures, loads in the facet joints, and then leading to arthritis of the facet joint. The disc in between the two adjacent vertebrae is showing shriveling, showing shrinkage, and the effect of this shrinkage is manifested here at the back in the facet joint. The smooth gliding surface is gone, and that is replaced with rough wavy edges of the damaged joint, which the bones do not articulate smoothly with each other. Instead, they have rough edges which rub against each other and lead to inflammation and subsequently pain arising from the facet joint. The causes of the facet joint syndrome are age-related wear and tear. As our age advances, the structures in the back, in the form of the disc or the joint or the articular cartilage, they develop a cumulative effect of wear and tear of day-to-day life, leading to structural changes and leading to arthritis. As the disc degenerates, the pressure overload of the facet joints increases. That is not always due to wear and tear, but sometimes it is because of the original malalignment of the facet joints, that they can be overloaded more than their capacity and then are more prone towards injury. Sometimes injury while playing sports, while doing running or while playing football, etc., or contact sports can also lead to some minor cracks and tears in the facet joint or the capsule of the facet joint, and this can also lead to onset of facet joint arthritis. Initially, there is a degeneration of the intervertebral discs, which leads to structural alteration in the disc, leading to wearing down of the disc. Once the disc wears down, the height of the disc starts collapsing. So the collapse of the disc would ultimately lead to narrowing of the space between the two adjacent vertebrae, and this in turn would lead to excessive pressure, leading to damage to the smooth articular cartilage of the facet joint, and this ultimately would cause facet joint arthropathy, what is called as a facet joint arthritis. This is the structure of a normal disc here on the left top. The central gel-like nucleus pulposus of the disc is surrounded by smooth outer layer of the disc, which is called as annulus fibrosus. These are concentric rings of tissue which protect the central nucleus pulposus. As the structure of the nucleus pulposus changes, it loses water content, it becomes brittle and fragile. It leads to increased loads on the outer tough layer of the annulus fibrosus, whose fibers get distorted, and the lamellar structure of the annulus fibrosus gets destroyed, leading to tears in the annulus and leading to loss of the disc height. This loss of disc height, we have already understood, would put more pressure here on the back at the facet joint, leading to damage to the cartilage, leading to arthritis and pain arising from that arthritic facet joint. So this is how a arthritic facet joint would look. The patients feel when they suffer from facet joint arthritis. Most of the times it is a back pain, and though it is not easy to differentiate facet joint pain from the conventional common back pain that a lot of patients feel, but there are subtle signs and symptoms that, if carefully talked to the patient and the patient is able to note them and differentiate, that can help a long way in identifying a pain arising from the facet joint as compared to the one arising from various other structures in the back. So acute episodes of facet joint pain will lead to persistent point tenderness overlying the inflamed joints. It can also cause discomfort, especially while leaning backward. Most of the times people think that bending forward is the cause of symptoms or cause of back problem, but facet joint arising pain usually would recur or get reproduced when the patient is made to bend backwards. There could be restricted range of motion. So this is a picture showing arthritic facet joint, showing the reddish tinge here represents the subsequent inflammation that happened after the facet joint has got damaged, and leading to inflammation or swelling of the structures that surround the facet joint, which become the source of persistent pain. as given by the patient and noted down by the treating physician, and then the doctor would do some examination on the patient's back, doing checking for the tender spots, location, and the type of things or movements that aggravate or reduce the symptoms. We may do x-rays and CT scan that can elicit the damage within the facet joint in a more precise manner, and sometimes bone scan and MRI scan can also be used to find out the damage done with the facet. The treatment of the facet joint syndrome is mostly conservative. When we say conservative means that the patients do not require any major surgical intervention to treat this pain if they are given a supportive care in the form of medication, in the form of cryotherapy like ice pack or ice massage, then using some physical therapy modalities like ultrasonic therapy or electric stimulation or muscle stretching. These all things can help a long way in treating as well as preventing the pain arising of the facet joint. Patients who fail to respond to the first line of treatment, that is the conservative and physical therapy treatment, may also get benefit by getting some spinal injections right into the joint which is damaged, or the nerve that supplies the facet joint can be numbed by giving an injection into the median branch, which usually supplies painful signals from the facet and leading to pain. And if we block that nerve, we can get rid of the patient's pain and symptoms. Sometimes these blocks can be combined with a cortisone block, where a small dose of steroid is injected into that affected area, leading to a reasonably mid-term to long-term relief of symptoms from a few months to a few years. But sometimes the pain come back very quickly after the injection. So in such cases, if the pains come back after the facet joint injection or the median branch injection, which is done under the control of a fluoroscope is a X-ray television where the surgeon is able to localize the exact target area in the patient's back, identify the bony structures and landmarks, and is able to deliver the needle into the target area very precisely. And once it is located into the precise target, the surgeon can deliver the drug into the target area and allowing the patient to have a significant relief from symptoms. If the pains come back even after the injection, one can consider a procedure called as a median branch rhizotomy. So by median branch rhizotomy, what do we mean is that the nerve that supplies the facet joint with painful signals, one can precisely localize that nerve or destroy this painful nerve ending by using electric signal. Now, there are a lot of apprehensions when we say a nerve is destroyed by electric current. Patients feel that they may become crippled or paralytic, or their bladder function or urinary function can get affected. That is not true, because these nerves do not control these end organs. They just simply take care of the pain arising from the facet joint. So once we block them or we damage them physically, there is no untoward side effect of this nerve damage. There are various ways and means to do the rhizotomy. So one can do just a fluoroscopic or X-ray guided rhizotomy, where the needle is inserted at close to the nerve, and once it is correctly localized, one can simply use a electrical cautery or a heating probe and damage the nerve. But the better method is a minimally invasive endoscopic treatment, where a camera is introduced, a miniature camera, which gives magnified and large images of that area to the TV monitor, and the surgeon is able to see this area with his eyes, and then he is able to identify the nerve and then use bipolar electrical signals or radio frequency probe to ablate the nerve. By ablating, we mean that the currents are stopped. So this type of procedure is very effective, especially when the patient has responded initially very well to the spinal injection procedure, and this can give a reasonably long relief from symptoms from a few years to several years. So this is one of the most modern treatment to help patients recover from facet joint pain. When everything else fails, one can just block the facet joint by surgical technique where the surgeons will put in screws across the damaged motion segment. So one can see here the screws are put from one vertebra to the other, from uh, starting from the back and putting right into the vertebral body, another screw put starting from the back put into the vertebral body, and the in between facet joint here that can be curated, that can be prepared for receiving bone graft, or one can put a bone graft in between the two vertebral body and also freshen up the surfaces of the facet joint to receive the autologous bone graft, that the bone that is taken from the patient's body and inserted at the area where we want to block the motion. So fusion surgery means that the painful motion, the movements which were causing pain, they are stopped by blocking using these screws and rods and putting in a bone graft. Once the fusion happens, there is no movement and the patient gets full relief of his symptoms arising out of a facet joint pain.